The one thing that I think is misunderstood with PKU is that it's not really a disease.
That's a misconception amongst GPs, chemists, the health service, because they just think you're another allergy.
I wish that people knew that PKU is, first of all, a lifelong condition, and it has to do not only with the physical health, but also with mental health.
A lot of people go off diet, and there's two problems with that. Well, one is in the short term, it causes lots of psychological problems, anxiety, depression, just a general fuzziness of thinking. And I even noticed that in my Chloe.
I know loads of PKU people that have ate the wrong things, and now they are a shell of themselves and not being able to be employed, not being able to hold down a relationship.
It's become clear that we've probably underestimated the hidden anxiety. To look at the impact of PKU, you don't just look at where the stone is, you look at the ripples around it, and the ripples really are quite wide.
So I think the point of view of it's just a diet, go away and do it, is a really, really massive oversimplification of what is a very complex, lifelong endurance kind of thing for everyone involved.
There are many challenges for our young people as they get older. I think the first challenge that they have is in the transition process.
When somebody goes from a paediatric to an adult service, many people actually discussed having quite a negative experience.
There's a disparity between the child service and the adult service, and I think that's kind of where people can get lost to follow up.
When people go to university for the first time, they may leave home for the first time. Some of them really struggle.
We actually need healthcare professionals to know that our centres exist and that patients should be referred back to them.
We have to build to environment that then patients with adult PKU or adult patients with PKU can be followed by specialized centers who have the knowledge, who have the experience, and who have the willingness. The best outcome of PKU patients is based on two things: having the access to treatment, whether it's dietary treatment or something else, and the access to newborn screening, so that you're diagnosed before some damage can come along.
Eu sou Ana Maria e tenho 36 anos, eu tenho PKU.
My daughter, Anna, she's 36 years old and she was detected as PKU persons with 2.5 years.
They should have an access to the best diagnosis and best treatment options, no matter where they are born, no matter where they are born.
The aim of guidelines officially is to set the stones which you have to obey.
If I would have the chance to talk to a politician just a minute, I would ask them if there is a chance to increase quality of life, shouldn't we do that with treatments that are available?
I would like to have a metabolic center, a treatment center for adults as well in Turkey.
We have to get into touch with that policy makers and to make them understand what PKU is, what the importance of PKU is, and what it really means to have PKU, to be followed for PKU and to be treated with PKU.
There is still a huge unmet medical need here to an extent like that. So there's new treatments coming. Medical technologies are advancing in all therapy areas, including PKU. So we need to make sure that we put in place the correct systems and processes and ambition to make sure that we get the best for all our PKU patients.
There needs to be more education about rare diseases, including PKU, across all health disciplines, particularly people who work in primary care. And that includes GPs, it includes counsellors and psychologists. So just that very first step of saying, I know what you have, I've heard of it, and understanding empathic response will be the first step in the healing process.